When I'm teaching the introductory class of cartography, I always tell students actually a picture is more than 1,000 words or worth 1,000 words. So once we have information visualized, actually every information is so intuitively and clearly being shown. So I think sometimes using maps is the most efficient and the most intuitive way to show a certain information to the public. So what I try to do within my own research is to actually design what we call easy to use or ergonomic applications on for example, an app on your mobile phone to support spatial orientation or wayfinding. The pandemic actually started from different continents and countries, and then I believe it was March 2020 we started to see there was the first case in New York being reported. The Capital Region Vaccine Network needs someone to provide the geospatial support because they want to know in each zip code zone what is the vaccination progress, no matter of your socioeconomic status, no matter of your social status or your skin color or income level, and everyone should be able to receive the vaccine equally. So that's the big efforts the task force was trying to achieve. Ever since the vaccine started to be rolled out, and actually all the eligible parties such as schools or pharmacies or local and health authorities, they can actually all apply to be called dispenser. So they're called point of dispensary. And so the network shared the data with me and with my team. So we will try to actually help them to map and to show where the locations are, whether those locations are in those areas. Actually, they want to actually further push more vaccine efforts. For example, those areas, actually the vaccine rates is relatively low. So that's why based on the location, they can decide if we can use some available locations as a pop-up sites, or we can establish a permanent sites for a vaccine based on all those data. We not only visualize the weekly progress of the vaccine rates in each zip code level, and we also actually adapted the social vulnerability from the CDC to help the task force of the vaccine network to find out at certain area the vaccination rates is very low, and we can look at their social vulnerability, that maybe they're vulnerable in terms of transportation needs, or they're vulnerable in terms of their language or minority status, or they're vulnerable because of their socioeconomic status. So by putting all those information together and overlay them as an interactive tool based on maps, so they can quickly click and look at exactly the numbers as well as the vulnerability of those certain areas. I've heard stories actually from the task force that they try to send mobile vaccine and buses to certain neighborhoods, maybe because I've identified that actually there are some neighborhoods they are actually quite vulnerable. Just by the task force themselves, they have been using the sites over 3,000 times already. And I think for the public website, and the hits has been over 1,000 as well. So, and I'm glad actually there are people where there are members of the community who are looking at the data and who are looking at the vaccination progress. We do want to make sure that the vaccine can reach out to more members of the community. That's why I feel the information could be visualized as soon as possible, because I think with just a day or even hours, and maybe lives can be saved as well. So this is the reason why I feel quite excited about this project.